It's a story we all know just a little too well because we've all been living it every day for the last 9 months.
Every situation that brings people together is a risk.
And yet again, cases are on the rise, restrictions back in place, but the message remains the same. There will be a light at the end of the tunnel. We just have to work together to get there. So tonight, we present to you a coronavirus special, We Together.
And thank you for joining us for this coronavirus special. I'm Molly Patt. Tonight we have 3 local leaders working to keep things going and healthy live on our show to answer your questions tonight. Everyone is spaced 6 feet apart from one another. We have Dr. Gianfranco Bazzino with the Shawnee County Health Department joining us from his house tonight. Dr. Donna Pudi from Stormont Vale Health is here, and Matt Pavarnik with the Greater Topeka Partnership is with us. Thank you all for being here tonight. But before we get to the questions, we want to update you on the latest numbers that we are seeing in Kansas right now. At this moment, more than 143,000 people in the state have tested positive since the pandemic started. More than 1,400 of those people in the state have died from this virus, and right now just more than 1,000 people are in the hospital fighting this virus in Kansas. And a big story over the last several days, bars and restaurants being forced to close at 9 p.m. to adhere to the new health order in Shawnee County. We talked to a couple business owners this weekend who say they really question how they'll pay rent and just make ends meet with this new restriction. So on that note, we want to start with Dr. Bazzino and Mr. Pavarnik. This one is hard because we want to keep the economy going. We want to support our local businesses, but we also want to stay safe. So how do we balance those two things with a restriction like this? Dr. Bazzino, let's have you start.
Sure. Good evening. Thanks for having me. It is a very difficult situation. I'm the first that will admit that. And it's not lost on us the fact that our decisions have a real impact on real people's lives. And I know that. And I really apologize to everybody who is impacted negatively by those decisions. But the reality is that our outbreak in Shawnee County is out of control. It just simply put is out of control. There is virus that's circulating just about anywhere. There are places in the country which have similar situation as ours that have gone in a total lockdown and have closed completely their bars and restaurants. We are working very hard to avoid those kind of measures. We don't think that that's necessary at this point, provided that we can slow down the spread of the virus and that people obey to the measures that we have already requested them to follow. So reducing the hours of operation is definitely going to create problems and damage and loss of revenue. I realize that. I would argue that it's better than closing down those places altogether. And really the rationale quickly is pretty simple. At this point, the only safe thing for people to do is to stay home as much as they can. It's just as simple as that. And so all the measures that we have introduced in the last few weeks are meant to discourage people from coming outside of their homes and congregating in groups and socializing together. And that's what bars and restaurants in many cases do, and what people do in those establishments. So that's the logic, and that's the reason we are doing that.
So do you think that there will ever, will we go back to a full shutdown, or is the balancing act really the answer there?
The situation is changing literally hour by hour. I'm sure that my colleagues at Stormont Vale can tell you about that. But so we don't like to remove any option from the table. But as I hope you can all see, we are really working very hard to avoid that kind of lockdown, which is even a term that I don't like, to be honest. We're trying to avoid more severe measures that would cause even more damage. And one of them would be obviously shutting down bars or restaurants altogether and shutting down other businesses. We are not in the business of shutting down businesses. That's not what public health does. We are in the business of creating safe conditions for people to run their lives. And sometimes, unfortunately, to do that, we have to put some boundaries and some limits to what people can do. This is one of those situations. It's unprecedented. It's a pandemic, nothing that any of us has experienced in our lifetime. We are taking this thing week by week, month by month, and we are using just as much limitations and mitigation activities as we think are necessary to slow down the spread. Nothing more and nothing less.
And Mr. Provarnik, on this same tune, Stephanie Heptig wrote to us saying that she's concerned with all the attention and coverage around bar closing times and that it will hurt small businesses even with those restrictions. So do you know how these businesses are doing and will they make it through this?
Sure. Well, let me just start by thanking Dr. Pizzino. We talk on a regular basis, and he has a heart for health, but he also has a heart for business, and I appreciate the open dialogue that we have. I will also say that respecting the virus and supporting business, they're not mutually conflicting. That's my conviction, and I believe that we can do both. First of all, as I must say, it's important that you wear your mask. It's important that you wash your hands. It's very important that you social distance, stay out of group gatherings, work remotely if you can. But at the same time, as you mentioned that there's concerns from small businesses, I've been hearing from small and large businesses recently, and they're worried. And so I would say that while you're respecting the virus, at the same time, with a vengeance, figure out how to be creative and safe in supporting businesses and small businesses. Let me just give you a little example. When you buy something from a business that employs people in Topeka, Kansas or Shawnee County, 68 of those dollars stay in this economy. If you buy online, $1 stays in this economy. And so I would just challenge everybody that while you're respecting the virus, at the same time, be very diligent about supporting our small businesses and our economy because it employs people.
All right, so Dr. Pizzino, I want to switch gears here a little bit. Jennifer Calderon says that she has called several different agencies when she sees guidelines not being enforced, but nothing is done. Does more need to be done to enforce the order, and can the health department enforce that order or only law enforcement?
Enforcement is a complicated and tricky issue, as I'm quickly discovering. First of all, let me start by saying that the Public Health Agency really has almost no enforcement authority. So I can issue those emergency orders. Those have the value and the force of law, but all I can do is requesting law enforcement to enforce my orders, but I really can't send officers to a certain business, or I cannot directly impose fines on any business. Those are actions that are taken by law enforcement agencies, specifically the Topeka Police Department, the Sheriff Department, and the District Attorney's Office. So we have been working with them, and we think that enforcement really should be limited to very, very rare extreme cases. Our main goal as a health department is to educate people and to gain people's confidence and support and compliance without having to resort to law enforcement agencies. But ultimately, it is not our job as public health agencies to go out and prosecute people. There are other bodies that are institutionally charged with that function.
And Mr. Provarnik, what are businesses saying to you about how they're feeling? I know that some are scared, that they're going to get shut down. We're going to go back to the way things were in March, and they say, we're not going to shut down. We can't. They have a family to feed and things to do as well. So what are businesses coming to you and saying about how they're feeling?
So there's fear, and there is actually despair, and I think part of the despair is comparing what might happen in the near future to what happened in the spring. But one of the things I'd like to say is that it is such a fine balancing act, and that's why Dr. Pizzino, we play on the same team. I mean, he may be on defense and I may be on offense, but we definitely play on the same team. So it's a fine balancing act. Some of the restrictions that are in place right now, they're actually in place so that we don't have any sort of a stay-at-home order or a shutdown, so that businesses can continue to operate. And so if we have some minor inconveniences now so that our people in our community can stay employed, then let's have those minor inconveniences. If you're not out supporting a business, if you're not out shopping or dining, stay home.
Yeah, and Matt, we're all tired of this. I think that we can all agree on that one, but we want to get healthy. We all want to be on that same page. But we, Shawnee County and Topeka, have worked really hard to get businesses growing in the area and get people excited again. A lot of downtown work. So through all of this, what is morale like now that some businesses have left and now some are wondering if they'll have to leave?
So the economic recovery is flattened a little bit, and our unemployment's 5.1%, which means 4,600 people are out of work right now, and that's much higher than it was pre-pandemic. But I've said it before, and I'll say it again, is that the diversification of our economy with financial services and food production and government and animal health, we are so poised to make a quick economic return. And so if we can dig deep and if we can do the things that Dr. Pezzino's asking you to do and that I'm asking you to do, we will have a very quick return to our momentum.
Absolutely. And holiday season coming around, so a perfect time to support local businesses. That is for sure. All right, well, we're going to take a short break here, but don't go anywhere because our coronavirus conversation continues. We're going to get more of your questions answered, including things about treatment, how the hospitals are holding up, and how to celebrate Thanksgiving safely in just a few days. Don't go anywhere. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
The KSNT Storm Tracker is sponsored by DOVETAIL Roofing.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
You've trusted him to give you your morning forecast.
98. Have a good weekend.
Now you can trust him for all of your morning news.
Good morning. Thanks for joining us.
Join David George, now on the news desk. Weekday mornings on KSNT News. Don't miss the holiday classic Elf at the historic Columbian Theater in Wamego.
Welcome back to our coronavirus discussion tonight. For our next segment, I am joined by Dr. Donna Pudi. Thank you for being here tonight. She is with Stormont Vail Health. So we want to get to our first viewer question. We have a lot of questions tonight. So Catherine French wants to know if masks impact transmission of the flu, and if not, what about coronavirus? Is that virus smaller than the flu virus? Can you kind of explain that?
So that's a great question, and we have not seen the flu numbers so far this year that we traditionally see at this time, and that's actually a phenomenon that's happening kind of all over the world. So there is some theory that the fact that more of us are wearing masks on a daily basis may be why we're not seeing the flu numbers that we normally would. So yes, in theory and in practice, it does impact the flu. Coronavirus is a smaller particle, so it is transmitted even more than the flu virus is. So whereas the flu typically is one person that it might infect, for every one person that's infected, someone who's infected with the coronavirus may actually infect 4 or more people. So it is definitely more contagious, but the mask does help in both cases.
Yeah, it'll be interesting to see those numbers as the cold weather starts up and flu season starts too. Now I want to talk about symptoms for a minute about coronavirus. Do children have different symptoms than adults, and are they still changing? We know that list was kind of going, adding and taking things off for a while. What is that looking like now?
Yeah, so we haven't had any changes from KDHE's official symptom list. We haven't had any changes recent to add any additional symptoms or take any off. But what we do know is that a lot of people can be asymptomatic, and this is even more common in children. So while children may seem perfectly well, or they may have just a little bit of a runny nose, that, you know, how many kids don't have runny noses as the temperatures fall, that may be all that they show from coronavirus, but they may actually be carrying COVID-19 and infect someone else that they're in contact with. So adults tend to have more symptoms than children do, but even some adults can be asymptomatic and still pass that infection on to others.
And so then we know that if you're symptom-free for a certain amount of time, you are considered recovered. So can a person who has completely recovered from the virus still be a carrier to others? So especially if it's believed if you have immunity for a certain amount of time, you can still go up and pick up germs around, and then you could carry them. Can you still spread those to others even if you're recovered?
That is a really, really important question. So we're still learning about the virus and the disease, but what we do know is that the current guidance is that someone is considered the most contagious in that first 10 days. If they were really, really severely ill or immunocompromised, we actually would like to extend that period for 20 days, that they may still be infectious at that point. But generally speaking, 10 days from the point of them starting with the infection, they're usually okay and not considered infectious after that point. And that was demonstrated through some culture science research from the CDC. That being said, immunity. So that is the big black box that's still unknown at this point. What we believe and what CDC has so far demonstrated and come out with is that it looks like for about 90 days that folks retain some level of protection potentially, but there have even been some cases that have been reported to have a reinfection even narrower than that interval. And you know, viruses often mutate too, so there's some risk in that as well. But beyond 90 days, we don't have the confidence at this point with the science that someone cannot be reinfected. So it's always better to be cautious. Yeah. But from an isolation standpoint, after that 10 days or 20 days, depending on the severity of the illness and the other health conditions that the person might have,
okay,
they're generally considered non-infectious.
Always learning. It's a new one.
Absolutely.
Well, let's talk about space at the hospitals. We know that it has been hard keeping staff healthy, giving all of the spread. So if capacity truly does hit, what would happen next?
You know, you guys have wonderful resources in the community that are doing everything they can to make space, to try and shift resources around, to make sure that we're able to provide the services to the community that it so desperately needs. But just as we see a higher infection rate in the community, our staff, our nurses, our physicians, you know, all of our resources, down to our housekeeping personnel, live in our community. And so they're more subject to getting infected as well. So when they go out on quarantine or actually have an infection, that is one less person in the hospital to help meet the needs of our community. And to give you a little bit of perspective, one nurse, that's typically 5 patients that she takes care of. So when we have 150 people out due to contacts with COVID out in the community or being sick themselves, it really does hamper our ability to make sure that we have all our beds available and to be able to deliver those resources widely. But we are being as creative as we can to make sure that we provide that support.
Yeah, really puts things into perspective there. All right, we're going to take a quick break here again, but we still have one more segment to come. Dr. Pizzino will join us again from his house. We're going to talk exposure testing and the message both of these doctors have for you coming up next.
We Together, a coronavirus discussion sponsored by Stormont Vale Health.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vale Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vale now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vale Health, empowering you together.
As we celebrate a decade of Noto, we encourage you to visit our Arts and Entertainment District. From businesses with deep roots to new favorites, you'll find an eclectic mix of shops of all kinds. Find one-of-a-kind items created by local artists and visit one of our restaurants or entertainment establishments for a unique experience. Noto has a variety of venues where families and friends can come together for a good time. Noto is not only the place to be on First Fridays, but throughout the rest of the month.
Welcome back to our coronavirus discussion. This is our final few minutes with you, so I have Dr. Donna Pudi back and Dr. Pizzino joining us live from his house again. First, Dr. Pizzino, Pam Leak wants to know if you can find out where people have tested if they test positive. Is a list out there for anybody to see?
I'm sorry, can you repeat the question? I missed the last part.
Yes, yeah. Is there a list out there that anybody can see where people have visited, have they been to, so that they can kind of do their own little contact tracing of people who have tested positive, where they've been at?
Got it, yes, thank you. So the Kansas Department of Health and Environment publishes a list of places where there are clusters, as they call them, and that's updated, I believe, once or twice a week. And it's posted on the website, I believe, of the Kansas Department of Health and Environment. But I do want to reassure the public that if there are clusters that are identified, our health department will investigate them and will notify everybody who was at risk of being exposed because of their presence in the cluster, or we'll make a public announcement to tell everybody who was in this particular public place and between the hours of X and Y on this date may have been exposed. So I don't think that there is really a need for people to try to do their own investigation. I think that's exactly what public health does. And if you have not heard from us and you know that you were part of a say business where a cluster has been reported, it means that you have not been identified as a close contact.
Okay, and so I'll ask both of you this one. Do you know of anyone who has had to get treated twice for the virus in our area? Dr. Donna Pudi, I'll have you start.
I don't know of anyone locally. I know there's been some publications of others outside of our region, but I don't know personally of anyone locally that has had to be hospitalized or treated twice.
Dr. Pizzino, have you heard or know anybody that's had to get treated twice?
No, as Dr. Donapudi indicated. Now, we did have people who occasionally, we have a few cases in which somebody has tested positive again 90 days after a first test that was positive. But that doesn't necessarily indicate reinfection. It could very well be that one of the two tests was a false positive. It doesn't happen very often, but occasionally it may happen. So to prove that there is a second infection, there is a need for more sophisticated lab tests that we don't have. It's something that academic institutions will do, where they try to isolate and culture the virus and compare the genetic composition of the first virus to the second virus. So it's really not something that's very easily done. But for practical purposes, the immunity is considered now to last for about 90 days. So anybody with symptoms that are comparable with coronavirus, even if they had coronavirus diagnosis before, if it has been more than 90 days, essentially you start blank again, and you need to be tested again and follow all the different precautions that everyone else does.
Okay, Dr. Donapudi, this is kind of a two-question. Let's talk about testing and how accurate they are. We know a lot of people are trying to get tested before they go see family for Thanksgiving. So I want you to talk about the accuracy of testing and then also what Thanksgiving will look like this year, you know, a little bit different to keep everybody safe.
There are a number of different tests out there. The one that we locally as a community have used most broadly is called PCR. It's kind of a genetic test, and that really does have a high rate of accuracy, with the caveat. The test is really the most sensitive once someone is already symptomatic. If they are asymptomatic, there is some guidance now from KDHE that 5 to 7 days after exposure, you can have some confidence in those results. But if you've been potentially exposed to somebody, or you don't know if you've been exposed to somebody and you have no symptoms and you're testing now in order to feel confident about an upcoming trip, that confidence, that security is not there. Because really, you have a 14-day window from the time of having been exposed to somebody during which you may develop symptoms or you may develop carrying the virus. So testing that day 1 or day 2 is a false reassurance, is a false sense of confidence that you are not infected.
And so then talk about Thanksgiving, you know, what should people do, you know, to be a little bit safer in gathering?
As hard as it is, ideally we should really be staying with the folks that are in our home. The folks that we live with, we already are exposed to day in and day out. Even introducing 1 or 2 people from outside the home into that combination, that one person will likely have come into contact with multiple others. Those others will have come into contact with the multiple others. So very, very quickly you have a cascade that increases your chance of exposure significantly. So if we're going to try and stem this tide and contain the surge that we're having, ideally we would stay only with the folks that we currently live with.
And Dr. Pizzino, real quickly here before we get to our last question, I know you and I have talked several times about herd immunity. Where are we with that? And is that still, you know, a topic of conversation for this?
Herd immunity, we are basically at the same place we were all the other times we talked about it. It's not a viable strategy in public health unless there is a vaccine and unless it is used through a vaccine. Just as simple as that. It's been demonstrated, argued many times, and frankly, everyone that in the current situations when we have people literally in the hallways of hospitals being treated there and staff working 24, 48 hours. I mean, we shouldn't even have the conversation. There is no herd immunity possible until we have a vaccine, period. And if I can add real quick what Dr. Donapudi said about testing and gathering for Thanksgiving is extremely important. A negative test today is not a free pass to a safe Thanksgiving gathering. Please do understand that. And I know that a lot of people are still relying on a negative test to make their decision. That is absolutely wrong. And the negative test adds nothing to the decision process.
And Dr. Donapudi, last question for you. You know, anybody out there doubting or denying how serious this virus really is, you know, still thinking that herd immunity is the way to go, or just, you know, doing whatever until they get the vaccine, what message do you want them to hear tonight, right now, if they still are doubting the severity of this?
I hope they will be fortunate. I hope their loved ones will be fortunate. But almost all of us have been touched already with someone that we know, love, and care for with this virus. Many of us will have empty seats at the tables in coming years due to this virus. Please, please take it seriously, because we can't put it back in the box once it's out.
All right. Thank you both so much for joining us for this coronavirus special tonight. If you still have a question or some came to mind while watching, keep sending them our way. All you have to do is email coronavirus@ksnt.com. That is all we have for you right now. Have a good night and stay healthy, and take what our local health experts and business experts have given you tonight.